Bismillahirrahmanirrahim. Assalamu alaikum rahmatullahi barakatuh. I am Dr. Abdus Sattar Chowdhury from Awmc Medical College, Physiology Department. My dear student, today I am going to discuss about the abnormal secretion of adrenal cortical hormones. There are two types of abnormal secretion. One is hypersecretion, another is hyposecretion of adrenal cortical hormones. First, I would like to discuss about the hyposecretion of adrenal cortical hormones. There are two types of hyposecretion. One is primary hyposecretion, another is secondary hyposecretion of adrenal cortical hormone. Primary hyposecretion is another name is adrenal insufficiency or hypoadrenalism. Another name is addition disease. Secondary hyposecretion of adrenal cortical hormones is secondary hypoadrenalism or secondary adrenal insufficiency. Now I am going to elaborate the primary hyposecretion. Another name is called addition disease. In that case, the adrenal cortical cells fails to produce sufficient amount of adrenocortical hormones due to primary atrophy of the adrenal cortical cells or trauma of the adrenal cortical cells. 80% of atrophy of the adrenal cortex is due to autoimmune disease. Adrenal cortical cells also atrophy due to tuberculous destruction of adrenal cortical cells, as well as primary adenoma of the adrenal cortical cells or some secondary metastasis from other organ that are cancer cells that destroy the adrenal cortical cells. Secondary hyposecretion of adrenal cortical cells is more common than primary hyposecretion. The secondary hyposecretion of adrenal cortical cells is due to impaired secretion of adrenal ACTH from anterior-pituitary gland that will release the secretion of ACTH, and ACTH will inhibit the secretion of glucocorticoid as well as androgen. Now, effects of lack of secretion of mineralocorticoids. As we know, the mineralocorticoid chief hormone is aldosterone, and aldosterone causes increased reabsorption of sodium chloride from renal tubules. When there is a decreased reabsorption of sodium chloride from the renal tubules, also water will reabsorb less. When these will produce, the ECF volume will decrease. When ECF volume is decreased, blood volume will decrease. Blood volume decrease, then cardiac output will decrease. When cardiac output is decreased, blood pressure will be lower. If the patient is not supported from the outside by mineralocorticoids, the patient may die within 4 to 15 days. It does indicate that mineralocorticoid is one of the life-saving hormones. Effect due to the hyposecretion of glucocorticoid. Glucocorticoid maintain the blood glucose level in between mean by increased gluconeogenesis and decreased glucose utilization by the cells. Also, glucocorticoid prevent the stress, and minor stress or minor infection may lead to death. Therefore, glucocorticoid also required for long life. An effect on hyposecretion of adrenal androgen is produce some effect, but also there is a hyperpigmentation of the skin and mucous membrane. In addition disease, there is a hyperpigmentation or increased deposition of melanin in the skin, usually in the lips as well as mucous membrane of the mouth. And sometimes melanin pigment is deposited is losses, and there is a very darkening melanin pigment deposited on the crease of the hand as well as elbow. What is Addisonian crisis? Addisonian crisis, patient having Addison disease during he face some stress condition, and in stress he needs more glucocorticoid, at least 6 to 10 fold more glucocorticoid. But if it is not provided from outside, that patient may lead to coma and death. That is called Addisonian crisis. Addisonian patient having a bracelet on her wrist. The bracelet contains name and diagnosis of the disease. On the way, if this patient is coma and he was rushed to the hospital, that hospital doctor, when he see this bracelet, then he quickly understand that it's this type of patient and the patient is to be treated according to that time. This is the hyposecretion of adrenal cortical hormone. Now, hypersecretion of adrenal cortical hormone, that is hypersecretion of glucocorticoids. The main hormone of glucocorticoid is cortisol, and it may leads to Cushing syndrome and Cushing disease. Cushing syndrome is ACTH independent and Cushing disease is ACTH dependent. What are the cause of Cushing disease as well as Cushing syndrome? Primary adenoma in the anterior pituitary that release more ACTH, and that ACTH comes through the blood to the adrenal cortex. Adrenal cortex stimulate and increase secretion of cortisol. And also some tumor develop in the hypothalamus, then hypothalamus release more corticotropin releasing hormone, and it comes to the anterior pituitary, and anterior pituitary release more ACTH, and again it stimulates the adrenal cortex to release more cortisol. And also ACTH, ectopic secretion of ACTH. In some cases there is any tumor or cancer in the abdomen, there is a ectopic secretion of ACTH that may lead to Cushing syndrome or Cushing disease. And also Cushing syndrome might be developed due to the primary adenoma in the adrenal cortical cells. Depress the activity of immunity, and that when depress the activities of immunity, the patient may lead to some infection may occur. And also mobilization of protein from the bone, that is osteoporosis, and the osteoporosis may lead to vertebral column collapse. And also mobilization of amino acid from subcutaneous tissue, that may lead to tear of the subcutaneous tissue, and it give a typical appearance of bluish stria. When the subcutaneous tissue is tear, that gives a bluish stria. These are the effect of hypersecretion of glucocorticoid. Now, also hypersecretion of mineralocorticoids, that is aldosterone. Aldosterone is usually secreted from the zona glomerulosa, and any tumor in the zona glomerulosa that will release the secretion of mineralocorticoids, that is aldosterone. When the primary tumor secrete more aldosterone, that is called primary hyperaldosteronism. It is another name is Kuhn's syndrome. Primary hyperaldosteronism or Kuhn's syndrome. And aldosterone, the main function of aldosterone is to preserve sodium in the plasma. In exchange of these, it will excrete more potassium and hydrogen ion. And symptoms is hypernatremia, that is plasma sodium concentration will increase about 4 to 6 millimole per liter, and there is a hypokalemia. Also there is a mild metabolic alkalosis, and those patients having primary hyperaldosteronism of Kuhn's syndrome having hypertension. And in that patient, the plasma renin level will be decreased. And the patient always suffer from muscle weakness due to hypokalemia. This is the function of hypos and hypersecretion of adrenal cortical hormones. I repeat this and summary. The hyposecretion of adrenal cortical hormones is primary hyposecretion and secondary hyposecretion. Primary hyposecretion is called addition disease, and secondary hyposecretion is called secondary adrenal insufficiency. And secondary adrenal insufficiency is more common than primary adrenal insufficiency. Similar in Cushing disease and Cushing syndrome. Cushing disease is ACTH dependent, and Cushing syndrome is non-ACTH dependent or ACTH independent. These two can be distinguished by knowing the serum level of cortisol as well as ACTH. In Cushing disease, the both ACTH and serum level of cortisol will be increased. But in Cushing syndrome, only the cortisol level is increased, but ACTH level is decreased. It is also the Cushing disease is more common than Cushing syndrome. And it is a very important question for written or viva. That is, it produces what are the effects that is produced due to the hypersecretion of glucocorticoid. I think it is enough for you. I could not give you more information. This is you. Today I would like to stop here. Next time I will continue in other topics. Thank you, my dear student. Stay at home. Be safe.